Okay, well, good morning, everybody. My name's Matt Green, and I'm with Accenture. I'm Accenture's account executive responsible for our health and public service business in Louisiana. So, Accenture is one of the world's leading professional services companies, but what's important are the outcomes we deliver to Louisiana. So, we have several active engagements with the state right now and with Blue Cross Blue Shield Louisiana. But the most notable one for today's discussion is our COVID-19 contact tracing work with the Office of Public Health. Back in May, OPH reached out to us and we contracted with them to implement our contact tracing solution, which has really proven to be one of the largest examples of coordinated public health outreach across multiple channels in recent memory. And it's been critical in helping to slow the spread in Louisiana. So today we're going to talk to you about our approach to our tailored outreach and engagement strategies. And with that, Kevin Ellenwood, who leads our Accenture Interactive practice, is going to help me talk through the presentation. Kevin?
Great, thanks Matt, and thanks for the quick intro. So Kevin Ellenwood, also Accenture with Accenture Interactive. We're the design, innovation, and communications offering group within Accenture, and I lead our global public sector work for Accenture, working across both public and our payer and provider practices as well. And one of the things that we wanted to really anchor back on is kind of this challenge, and we've heard a lot through the panel discussion earlier today, which is the statements around communications and identifying the right channel, the right place, the right audience. And we think that's really important. And one of the things with Accenture is, we don't necessarily build products. What we really do within the healthcare space is we build experiences. And we focus on this building of experiences that are highly targeted to the individuals that we're trying to serve. And the way we do that and how we go about structuring this is really through a human-centered design approach. We go in, we talk to the individuals, and we realize right off the bat that there isn't a one-size-fits-all. So we go through an extensive discovery. We do a lot of interviews, both with members and with staff, and then we go out and we actually build very specific targeted communications programs that speak specifically to the individuals. We try to keep them simple, keep them very pointed. And then once we get going, then we look to accelerate them, and then we innovate around those, grow and change and adapt as we go. So why do we do that? One of the things that really comes into play is this concept that experience ecosystems, platforms that we use in order to deliver multi-channel digital and physical experiences they're super complex. And when you start to really peel back the onion, you're really dealing with a lot of different technologies that come into play. And quite frankly, there's thousands of different ways in which you can combine and architect different technologies in order to get there. What we find is important is to anchor back on what is the actual thing that you're looking to deliver. So we try to get away from being really buried into the very nature of tying all the different technical pieces together. That comes when we execute on these programs. But first and foremost, we focus on what is the underlying experience that we're looking to deliver. And we look to simplify when we're doing that. And as we do that, we look at all the various ways in which we could be communicating with an individual and a member in the healthcare space. So we start to really focus on all the available channels, but then we go back and we look at the actual individual and try to understand who the individual is that we're trying to serve, what's the problem that we're trying to solve, and then how do we get that information to them. So an example I like to share a lot, and this is from a couple of years ago, working in the provider space with a health system. They had a very specific issue. They served a suburban population, and it was a children's health system. What they did is they were having a lot of cancellations of tonsillectomies, and they couldn't understand why they weren't able to get it through to their members that, you can't feed your kids before they come in that morning. The doctors were communicating, the nurses were communicating it, and the message wasn't getting through. And we kind of sat down with them, we talked through the actual target audience and understood that they were really servicing this middle-class suburban population that typically two working parents and text was the best mode of communications. So we implemented a very simple proof of concept text program with them right off the bat, got permission to text to the individuals when they signed up for the appointment, and lowered their cancellation by 80% by simply texting the night before, hey, you know what, don't feed your kid in the morning. And the morning of, reminder, no breakfast today, got surgery. Put those rules in place, dramatically started saving money and getting better results. So that was, one place that we looked in order to really personalize communications and keep it somewhat simple. It seems pretty obvious when you really think about it. Busy mom, send her a text message in the morning reminding her of the steps. Not a complicated technology play as well. But we also understand that not all technology and communications is going to work for any audience that we try to engage with. And we do a lot of experience work in the public health space with state Medicare agencies. And some of the work that we did in another state around infant mortality really focused around this concept of how can we get parents to better engage through the through the pregnancy and then after the infant is born, to either keep their appointments or just follow some basic best practices in order to address an infant mortality problem that they were having within the state. So we spent a lot of time talking to families in this situation. And one of the things that we found very early was that the state was relying on the medical providers to communicate things to the families. And quite frankly, the families didn't have the level of trust with some of these community clinics that they have with some of the CBOs. And one example there that I like to kind of point to was this young woman that we talked to who didn't go through any of her wellness checks during her pregnancy. This was her second kid. She was 18. And what we found that happened was after her first child, everything was great. She then was pregnant again at 18. She went into the clinic. And what ended up happening is the receptionist said to her, I can't believe you're back again, which, horrible statement. So we kind of spent some time talking through that with the care provider. And, I had a pretty tenacious analyst who dug in and found that the receptionist said, it's great to see you, and was pretty excited to have her back. But what she heard was very different. And the big takeaway from there is, sometimes we need to take the communications out of the clinicians and move into our CBOs, community-based organizations, leverage the people that are there that are trusted in order to actually have those conversations. So when we look at building these communications programs within the space, we look at building programs that target the members or the participants in the plans. We look at programs that target some of the healthcare providers, but then we also look at programs that we need to leverage that target the CBOs and use them to actually activate some of these communications as well. And we really try to activate that entire set of channels outside of just the digital, physical, and paper and mail channels that are going out to the individuals. So what we did is we put together some use cases that we wanted to share of how we've done this in different places, and just some kind of stories that we've put in place. And we wanted to do here is kind of visualize for you the way we're leveraging both paid media, earned media, email communications, text communications, physical communications, in order to engage with an individual at any given point in their healthcare journey. And we do this across both the public and the private health space at different states and with different provider practices as well. So one of the things that we look at is an example with Cody, who's one of our mindsets that we built out in order to demonstrate this. And he's a young kid in his late teens, looking to really understand more about flu shots, flu vaccines, very concerned about it. And what he finds is an email when working with his mom, and it points him to a flu shot, points him where to go to get more information. In turn, to go along with that email, we also allow them to then pivot to a website, sign up for text messages, opt in for information. Again, now we're capturing the channels that they start to prefer. In this case, for Cody and his mom, text is something that they prefer. Then we move into allowing them to set up appointments, go through schedulers, and then ultimately schedule the appointments and then get follow-up information sent when they've come out of the appointment. So, overall, when we start looking at, how do we want to engage with Cody? Well, he opted in for an email at one point, but then we immediately jump into what are some other channels that are available for you? How can we activate those channels and then have a meaningful communication and dialogue, all with the goal of a specific outcome? And the outcome in this case is to, get Cody and his mom in for flu shots so that we can really have, a healthier population within the state, and we can have better outcomes for the individuals that we're providing services to. Another example that we've built out that we see a lot of states moving towards is this concept of leveraging, chatbot services or virtual agents. And I'm going to play a quick video here for you guys of an example that we built out in another use case.
This is Alicia. She's expecting her first child, but just got laid off. Fortunately, her mom has some helpful advice. Later that day, in search of options, Alicia Googles Louisiana Medicaid. The service hotline isn't open, but then she spots the Chat Now option. That's where Stacy, the chat representative, comes in. After a few initial questions, Stacy prompts Alicia to apply for benefits. When Alicia submits her application, she wonders if she'll have to change providers, but is relieved to find her doctor is a participant. Stacy then gives Alicia information on other programs to support her and her baby, and the opportunity to opt into SMS messages. The next day, Stacy sends Alicia a personalized message and a short recap of the chat to go with her peace of mind.
So, we love chat. We love virtual agents because, that allows us to connect with the population 24/7, and it's always on. But we also recognize that simply because we're providing this always on service with a virtual agent, it doesn't mean it's going to address the 40% of the individuals that don't have broadband access or some type of mobile device. It's not going to address the individuals that just aren't comfortable with the technology. And we need to make sure that when we're activating these types of channels, we're activating other channels as well. So one of the things that we do to go along with that is we try to activate community-based organizations. And an example I wanted to share with you guys is one we built out with our partner Salesforce on really a 4-week sprint for Oklahoma. Oklahoma had a very specific issue that they wanted to address. The governor had a program that was focused on 3 things: kids that are aging out of foster care, recidivism coming out of the criminal system when people are getting out of prison, and high school dropouts. And it seemed like a huge problem, 3, 4, 5,000 individuals per year that are, having this experience, and how can they make it bite-sized? So there what we did is we broke it down into small, local, regional bites where you might have 3 or 4 kids aging out of foster care. And then we created a program not to engage the individuals, but to engage the community-based organizations and then give them the tools and the power that they need to then engage with the individuals. So what it allowed us to do is activate yet another channel, which is this CVO channel, which we find very powerful in dealing with some of our rural populations or some of the more economically disadvantaged populations as well. So thank you. I know we're about we're a little over the 12-minute mark. So what I want to do is pivot to the Q&A.